America's Healthcare Challenge with Sean McGuire.
Joining us now on America's Healthcare Challenge, Greg Booth. Greg is a partner at Myers and Flowers law firm, where he specializes in workers' comp law. He heads their department. But he's also been in the news for another reason, which you're soon to find out, having some nightmarish experiences as it relates to this whole COVID-19 crisis. And he was gracious enough to take time out of his busy schedule to join us and tell us his story. Greg, thanks for joining us. Great to see you. By the way, I must confess to the listeners, we both went to Marquette University, we're good friends, and we're in the same fraternity. So it's great to see you. I haven't seen you in a couple of years. How you been doing, my friend?
Yeah, doing good, Sean. Good seeing you too, and thanks for having me on. Happy to share my experiences with people.
We've been talking about March Madness. Talk about your March Madness story that you've had the last couple of weeks.
Yeah, so March Madness is a big thing with our law firm too. In fact, we do a lot of work with police officers and firemen and first responders and that sort of thing. And we host a March Madness party every year to just kind of give back to those people in our community that are risking their lives every day to help us. And so we had to cancel. We usually get about 60 or 70 people out, and it's always a good time and to see some familiar faces, just to kind of hang out and watch some of the games. And we had to cancel that. So yeah, March Madness was uneventful this year. I was looking forward to some good games, and I thought the tournament was pretty wide open. I mean, I don't know that there was any clear-cut favorite this year, so it's a shame that it got canceled, but obviously for good reasons.
I'm going to put up a shot of the story. Was that from the Star Herald, I believe?
The Daily Herald. Yeah, Daily Herald.
Daily Herald. Okay. And you're located in Aurora, Illinois?
Correct. Yeah, it's about 40 miles.
Tell Wayne and
out of
Garth what's
Chicago.
up, by the way.
Yeah, Wayne's World.
Famous home of Wayne's World. Yeah, exactly. So you've been hunkered down in Aurora for the past couple of weeks. So let's get into this story. I'm going to put a copy of the article up on the screen so the watchers can see. But what happened with you? You kind of had a big scare and had a really disruptive couple of weeks, huh?
Yeah. It started out with just kind of feeling some achiness and some weakness and some chills, typical fever type symptoms. That was on the night of the 17th, and took my temperature and found out it was right around 100 degrees. Not terrible, but obviously something going on. Tried to sleep it off over the night and had terrible night sweats. And so then the next day on the 18th, I decided that I wasn't going to risk anything. I have a wife and a young daughter. So I decided I was going to go down and into our basement. And, I've been working from home anyway, so doing some work down there and just kind of started staying down there. And actually, my symptoms started getting worse over the next few days.
So what did you do? Did you go get tested at that point?
Yeah, so I have an underlying condition. I do have asthma, and I've had it since I was a child. So when the fever didn't go away, I started to also develop some tightness in my chest, started to develop a cough, and had a little bit of difficulty breathing. And so I called my doctor, and the first thing they did was say, well, let's just test you for the regular flu, influenza A and B. I went in and got that test done, and that was a negative. And when that was negative, my doctor said, you know what, let's go ahead and get this ordered because we want to make sure we know what's going on. So I had a COVID-19 test performed on March 18th, 2020, at a local hospital. And when I went there, it was a drive-through service. I pulled up, rolled down the window. The nurse comes out, gives you the nasal swab. They say it's going to be about 3 days, and they sent me on my way to go back home, where I went back into my basement and self-isolated. So that was on a Wednesday, and then I was hoping, by Friday, Saturday, I would get those results. I didn't get them, and on Monday, kind of started looking into it a little bit more, making some phone calls. Over the weekend, my cough developed even more. I started coughing even more. And actually on Saturday, when I was hoping I'd be getting my results, instead, I ended up coughing up some blood that day. And so that triggered me to go to the emergency room right away. And that was a unique experience in itself.
Did you see, were there other patients in there, being treated for similar conditions that you could tell? Or?
No, in fact, it was kind of strange. I called ahead to let them know I'm coming. I've already had the test. I don't have the results. Here's what's going on with me. I'm going to be coming into the ER. And when I got there, they had nurses ready, waiting for me at the entrance. They walked me through the waiting room, which was completely empty, and then into a back isolation room with zero pressure and for acute respiratory illness. And they came in. Obviously, everyone's wearing masks and all the PPE equipment. But they did a chest X-ray, and then that was negative. And the doctor basically said, "We're discharging you home." I was there for about an hour total, which is a very fast emergency room visit for someone with a fever, a cough, coughing up blood, pre-existing, respiratory issues, and also not knowing the results of my tests. So that was a little frustrating, and the doctor assured me that there was nothing else that they needed to do. There was no admission that was necessary, and I was discharged home.
So how long did it actually take for you to get the test?
So to get the test itself, or to get the results?
Oh, yeah, to get the results. I'm sorry.
Yeah, so the results, I didn't, let me back up. So I had it Wednesday the 18th. That following week, I hadn't heard anything, and I started calling around, calling to the hospital, calling to our local COVID hotline, calling to our health department, calling my doctor. Nobody could give me an answer. Nobody could tell me where the test was. Nobody could tell me what my results were. Nobody could tell me what lab it was sent to. And so it was very, very frustrating. And then everyone I talked to said, well, maybe it'll be 5 days. And then maybe it was 7 days. That Friday, the following Friday, so that would be about 10 days later, I still didn't have an answer. And I reached out to the media at that point because I couldn't believe that I was still waiting 10 days for the results to my test. By that time, I'd actually already started feeling well. And so it wasn't until the media got involved that then on Saturday, which was 11 days after I had the test, I got a phone call at 7:30 at night from the hospital saying, "We have your results, and good news, you're negative for coronavirus." But
wow.
I actually didn't get the results from the lab until yesterday, Monday the 30th, is when I actually got the notification that my results had posted to the lab's website to notify me. So I think someone made a special call to get those results to me on Saturday, but had that not happened, I would not have gotten results for 13 days after taking the COVID test.
It's unbelievable. I mean, I'm so glad that you're recovered, but your mind starts to wander, about other people. There's got to be other people out there just like you that are going through this, and we're fortunate to both be educated and assertive individuals. So I'm sure you were quite assertive on the phone, trying to get to the bottom of this. What advice would you have for somebody, looking back, that might be basically going through the exact same thing that you're going through, on how to get to the bottom of something like this, how to navigate this incredibly complex maze?
Yeah, so first of all, my advice is do what I did. That is, self-isolate. You have to quarantine yourself. Everyone I talked to said, you did everything you were supposed to do. It was the most difficult thing I've ever done, to be away from my family and my wife and my daughter for almost 2 weeks. But it was necessary, because you can't take that risk of whether or not you have it and exposing other people to it, especially the people that you care about the most in your household. So number one, you have to do everything right. But number two, just keep keep pressing for answers, because if you sit back and do nothing, you're not going to get anything. I kept being told you will get a phone call. No one called me. In fact, had the media not gotten involved, I wouldn't have gotten that phone call. I would have gotten an email from the lab 13 days later. Nobody would have called me with those results. And in the process of doing so, I've also learned that some places are not calling back people who have negative results right away. So, which is understandable. People who have a positive result should be called first. But that doesn't mean people who have a negative result should wait a week and a half or 2 weeks. So if you're in that situation and you've been tested and you've got all these symptoms and you're just not feeling well, maybe you're going to start to feel well and you think, I can be done with this. But if you don't have those results, it's really dangerous not to make sure. And so you really have to press forward. The one place that I actually looked into that helped out a little bit was I was able, through looking online, to determine the local lab that this hospital typically sends their results to. And actually, they were very helpful to say, we don't have those results. They were sent to California, to a lab in California. And from there, I was able to determine the lab that it was sent to and sign up for those updates as my testing process was going through. Kind of a strange twist, the results that I got back were actually from a lab in Virginia. Same company, but a lab in Virginia.
Wow. Just that's unbelievable if you think about it.
And nobody knew, nobody could tell me the lab that they were sent to. So nobody from the hospital was able to tell me that information. It was actually a local lab that the hospital uses that said, no, we don't have it here. We can look and see where it was sent, and here's where it was sent. And so without that information, I never would have even known what lab it was sent to. So it's easy to say, go online and sign up for their messaging system. But if you don't know where your test results are at, you're never going to find it.
So literally a day was lost in transport. If you're in Illinois, to fly to California, it's got to take 3 or 4 hours just to fly. What was it, a little vial or something like that? Just to fly that. And then to fly all the way across the country, which is like 5 hours. Yeah,
to Virginia. So in the process of this, I learned that my test was on the 18th. It was not actually, and this is, hearing it from multiple sources, so I can't confirm any of this, but what I was told was that my test was not even opened and to begin to be processed until the 25th, which was a week later. So where that test went from outside of Chicago to California to Virginia, and how long that took, I have no idea, but they didn't even start looking at my test for a week.
On that point of some sort of, the issue of false positives or false negatives, how can we be so sure that that's an accurate test if it's been sitting there for a week? I don't know.
That's
you know what I'm saying?
It's a great question, Sean, and one I kind of started digging into, because I'll tell you, with the symptoms I had, a fever for 4 days and then a cough for another 5 days after that, I was sick for 9 days. And if it wasn't the coronavirus, I don't know what it was. I've never been that sick in my life.
Really?
All that anyone
you have conditions. You've had asthma, so you've had infections like that before, but this is on a whole other level. Huh?
I get a flu shot every year, and unfortunately, you can still get the flu. I've had the flu. I've had respiratory issues, sinus infections, all that stuff. I was sick for 9 days, and so I've been told it was some other virus. Well, we know it wasn't the flu. We know it wasn't coronavirus. So coincidentally, I can't tell you what that was, but there's an interesting article that came out in the Washington Post. I believe it was on March 26th. It was about 4 or 5 days ago, talking about false negatives. And the article actually says there's about a 15% chance of a false negative with these testings. And a lot of that has to do with the timing of the test. So I was tested very early on in the process, and in with my symptoms as well. And so if the swab isn't done accurately, or if you don't have enough of the virus load for it to pick it up, you can get a negative test. I don't have the background to talk about the delay in the processing and shipment, and if that vial is still good. And I don't know those answers, but I would assume that there's certainly some risk of a sample sitting around for 7 to 10 days before it's being tested. That can't be good. There's certainly an issue of, false negatives. And you start thinking about that too, well, can I come out of isolation? Well, yeah, I got a negative test, but I was feeling terrible. So, I actually spent another night down in my basement to make sure my daughter was already sleeping. And I thought, you know what, I'm not going to risk it. I'm going to stay down here a little bit longer, just because you just don't know. And I wanted to make sure. But thankfully now I've been feeling good for 3 or 4 days now. So I'm pretty confident that I don't have any more symptoms.
On a lighter note, like, how many F-bombs do you think you dropped, as you were trying to get to the bottom of this? Number one. Number two, I imagine you had to binge watch some sort of shows. Being in self-isolation, got any recommendations for the viewers out there?
Yeah, so for the first question, there were quite a few. Most of them were directed at people who couldn't tell me any information. And these are the people who are running their departments, who are running big organizations, and can't even tell me where my test has been sent. And not only can they not tell me, they also can't direct me to the right person. So the hospital would direct me to the hotline. The hotline would direct me to my doctor. My doctor would direct me back to the hospital. And so I was just going in circles. And I probably talked to 3 dozen people throughout different organizations trying to figure out what's going on. So very frustrating, that the whole process. As far as shows, yeah, a lot of Netflix, man. I watched Pandemic, highly recommend it. It's a little bit eerie because it was filmed in spring, summer of 2019, and completely predicted that, another virus was going to be the next pandemic that happens in the United States. Very, very cool stuff. And talking about testing, of all things, bats, obviously different birds, and also some cool research that's going on with pigs and that sort of thing. So trying to develop a influenza vaccine, a universal influenza vaccine for everyone. So that was a great show. And obviously some terrible TV too. It's like Tiger King and things that just kind of keep you entertained.
Awesome. Any final thoughts, Greg?
Yeah.
On this?
As far as our testing in this country goes, there's no excuse for that. There's no excuse. And I understand the labs are overrun. I understand the hospitals are very busy. And there's a lot of people who are sick, and there's a lot of tests being done, but number one, we need quicker testing. We need a quicker turnaround. I know that there's been reports of FDA approving 45-minute tests, and now new 5-minute tests are being developed. That absolutely needs to happen, because no one needs to be sitting alone, isolated for 11 or 13 days, waiting for test results. So quicker testing is important. Reliable testing, we talked about false negatives, that sort of thing. 15%, if that number is true, and I took that from a Washington Post article, that's way, way, way too high for a false negative on something like this. It's too important. And if people have the virus and are being told they don't, that's a great way to spread it to other people. So reliable testing is very important. We've got to get those percentages down. We need more testing. Not enough people are being tested. We've seen other countries like South Korea and the numbers of people that they were able to test. There's no excuse why the United States isn't able to do that. And then lastly, something that, I've just been talking about with some other friends and stuff is antibody testing. And so we need to get that up and running, because that's going to be a way that people can check to see if they've actually been exposed to this virus. People who maybe didn't have any symptoms, people who had mild symptoms, people who had a family member, a friend that had it, but they don't know if they've been exposed, or people like me who are really sick and were told you didn't have it. It sure would be nice to know if I did. And through antibody testing, we'll be able to figure that stuff out to say, hey, you've got these antibodies, and hopefully there'll be some immunity towards this virus in the future.
Here. Thanks so much for joining us, Greg. Great thoughts, great story. We really appreciate you letting the viewers in on kind of your personal struggles that you had to go through this last month. We're so glad that you're feeling well. We hope you can come back and join us again sometime.
Yeah, thanks a lot, Sean. Thanks for the interview, and everyone listening, stay safe and healthy.
Scotty doesn't know that Fiona and me do it in my van every Sunday. She tells him she's in church, but she doesn't go. Still she's on her knees, and Scotty doesn't know. Oh, Scotty doesn't know. So don't tell Scotty. Scotty doesn't know. Scotty doesn't know.